It's a
You did
hard
good.
name. Okay, Badero, that one I got.
Yes.
Okay, he's a cardio-nephrologist and executive director of Cardiac, Renal, and Vascular Associates here in town. And I don't think people realize sometimes how integrated renal function and cardio function are.
That is correct, Stephanie. 25% of your blood volume actually from the heart goes to the kidneys. And, we always say the kidney is like a little brother of the heart. Anything that affects the heart does affect the kidneys. And sometimes even when the kidneys go bad, the heart also suffers for it. So, yeah, they're kind of very interrelated, mostly.
We're talking about the high numbers for women who die from cardiac arrest, women who suffer from heart disease. Why is this so prevalent in women? Is it that we're not taking care of ourselves, we're not eating right, we're not exercising? Why is it so prevalent with women?
That's a great question, Maggie. Before I answer that question, I just want to kind of let people realize, the magnitude of the problem. I mean, right now in the United States, 1 out of every 4 women dies, in the United States. 1 woman dies every minute. In the world, 8.6 million women die yearly. I mean, we have in the United States 8 million people living with heart disease. I mean, that's a very significant problem. And what's interesting is 54% of women do not even know that heart disease is the #1 killer. It's the #1 killer in African Americans, the #1 killer in Caucasians. When you talk about Mexican population, it's actually second to cancer, also in Asians. But a lot of people don't know that they have heart disease, and the reason why is because these symptoms are not the traditional symptoms that we get in men. I mean, typically in men, what happens is you have the traditional symptoms, which is chest pain, located in the mid-sternal portion, goes to your left arm. But in women, it can just be bloating. It might be feeling of indigestion, it might be headaches, it might be back pain, it might be just sweating, and a lot of times people think it's hormonal. And that's why we don't really realize that, So I think the awareness needs to be there and people need to become more aware. And then the other thing is men usually call 911, actually their wives call 911, but studies have shown that for women, they wait 22 more minutes to call 911. And then also in menopausal women, the low estrogen factor has been shown to correlate with what we call microvascular disease. So men typically have diseases, the major arteries of the heart. Women have smaller vessel disease. And also the plaque distribution, which is the cholesterol that we see lining the inner arteries. For men, it's more distributed in clumps, and in women, it's more evenly distributed. So when you take the pictures or angiograms and things like that, it might be very different compared to women.
Is there anything you can do in your adult life, whether it's a young adult, middle age, or whatever, to help that so that you don't get those plaques and you don't get all those potential heart problems?
Well, currently in Mississippi, 70% of Mississippi population are obese. So obviously the diet is very important. We need to be more active. We need to eat better. We need to become, more active in our daily lives, pretty much. We need to stop smoking. The fastest growing population of smokers right now are young women. And in Mississippi, currently 20% of women smoke. So we need to stop smoking. You need to, I always say, sleep more. S, stop smoking. L, lose some weight. E, eat right food. The other E is exercise. And P means practice safe engage in safe practices. You need to eat better. Instead of frying your food, just bake them and boil them. Try to walk 45 minutes every day, 5 days a week. We just need to listen more to our bodies. Women are they're so intelligent, so smart. I had a woman who once told me, she said, you don't have to have a stethoscope to listen to your heart. You can just listen to your heart. Your heart is talking to you every time. We need to listen more to our bodies and listen to more to our heart. We listen to our hearts when you fall in love with that significant other. Why don't you listen to your heart when your heart is talking to you all the time?
Now, the American Heart Association and doctors like you and so many others are getting the word out. We're hearing it more and more often about taking care of ourselves and making sure that we are heart healthy. Are we just being hard-headed and not listening, or what is the problem? Especially because the information is out there.
Well, I don't think we're hard-headed. I think we're a very smart a group in the country and also in Mississippi. I think exactly like I said before, sometimes even in the studies that have been done, women have been underrepresented. And so that has also contributed to the fact that the disease is very not as well known. But a lot of times, I think is because we've not raised much of the awareness. People think, like I said again, women just think it's hormonal. And women, they're very, God bless women. They're like mothers. They're like
they
mother
take
hen.
care of everybody.
They take care of everybody, and they're the last one to take care of themselves. And I think that's probably one of the reasons.
All right. Dr. Badero, I'm not going to try his first name again, but you're at Cardiac, Renal, and Vascular Associates, and that's here in town.
That's correct.
Thank you so much for sharing with us.
Thanks for having
Thank
me,
you
Maggie
so
and
much.
Stephanie.
Thank you, Dr. Badero and Stephanie. Now, this next story will get your heart pumping. Students at a Houston school had an unwelcomed visitor today. Let's just say sheriff's deputies had to wrestle with this particular trespasser. This is the Gator guy or gal. Now, they were hanging out in the shade right near the front door of Beck Junior High School, minding its own business. This is an alligator again, when deputies got the call. And the heave-ho tug-of-war then got underway. Teachers were inside preparing for the start of school, but no students were on campus. The good news here, no one was hurt, including the alligator.